You're listening to Age to Perfection, where we redefine aging, celebrate every milestone, and empower women to thrive at every age. We're so grateful to have you as part of our community. Don't forget to hit that subscribe button so you never miss another episode. Cheers to being aged to perfection.
Hi, everybody, and welcome to another episode of Age to Perfection with Dr. Patel. And you guys, I am so excited today because we are sitting down with Dr. Arain. And let me tell you the reason I'm so excited, because she's not a doctor. She's actually a dentist. And she is a cosmetic dentist. So Dr. Arain she essentially started her journey from the bottom and worked her way up. She started as a dental assistant in undergrad, being the scut monkey for everybody, everybody. Yep. And then decided this is not the way to live. So we went to dental school, actually in Houston, UT. Yeah, UT dental school in Houston, and then made our way into cosmetic dentistry. And so now we're not just about, fixing people's teeth, but we're about perfect smiles. I thought this would be a really good topic to speak with you about, because I'm constantly battling a jawline for my patients. And I know you are too. And this is it's very much a team effort, I feel like, between your cosmetic provider and your dentist. And I feel like there's a lot in your world that I don't understand as a provider. And so I wanted to sit down and not just learn for myself, but I feel like my patients would want to know where it kind of all plays in. So guys, we can go so many ways into jawline, but I really want us to talk about masseters. I want us to talk about gummy lines. I want us to talk about that snatched jawline. And the things that limit you and the things that limit me, and what we should kind of be looking for together as providers, right? Okay, so let's talk into it because we've got a lot to cover. Let's start with TMJ.
Yes. Okay. TMJ. TMJ is like this big black hole in dentistry. A lot of providers are very well versed in TMJ, and a lot of them are not. But everything starts with the jaw joint. You have your maxilla, which is your part of your skull. You can't move that. But the mandible is the only jaw in your body that's double jointed. And so those two joints, sometimes if you have trauma or just parafunction, like habits like clenching, grinding, all that stuff, what it'll do is it'll put strain on your joint. And that joint now is misaligned. And when the joint's misaligned, because your teeth are in your jaw, your teeth are essentially misaligned. And then what happens is we see patients have more wear, more grinding on their teeth, more breakdown of their teeth. And that ultimately leads to effects in their jawline. Their actual vertical dimension, we call it, there's a distance between the tip of your nose and your chin. That starts to change.
Yeah, then that's what we pay attention to too.
Oh my gosh, amazing.
So, and that's what we're taught. When we look at aesthetics, you're taught about angles, you're taught about proportions, you're taught about making sure those proportions and those angles are balanced to that person, not to make you feel like anybody else. Okay. For those of our patients that don't know, TMJ, yes, the joint part of it, but what are the symptoms? Like when people don't realize this could be TMJ?
Great question. Sometimes there's no symptoms, but a lot of times you will find clicking, popping, even crepitus, which means that when you open or close your jaw, you kind of feel like a little bit of like a
kind of like your knee joints.
Like bone to bone. Yeah, exactly. It's literally like a knee joint. It's a double-ended knee joint. And so you feel that. And a lot of times patients are like, well, it doesn't hurt, so I'm fine. Pain is never a good indicator of dental health. That's like our favorite line at our office. Pain is not a good indicator. So just because you're not in pain doesn't mean there's not a problem. Unfortunately, they don't come in until it turns into pain, because that misalignment, what it'll do is that popping, clicking, the crepitus, that cracking sound, what it'll do is it'll cause things to shift in your jaw joint, and then you start having possibly a little bit of either limited opening or pain when you open and close. And that's when people get a little more concerned and come in and say, okay, well, this is hurting now. I should probably go get checked. And a lot of times when you're at that point is when we send you to a TMJ specialist or to you guys or someone to get things like Botox or alternative treatment to try to calm that joint down in order to, help the masseter, help everything just kind of maintain everything and kind of keep it under control, the only way to actually fix it is surgery, which a lot of people can't afford. So TMJ is a big, it's something in dentistry that you shouldn't wait on. Like if you feel like you have some kind of popping, clicking symptom, see a dentist.
Yes.
Get it checked, because you never know what effects it's having on your teeth and what long-term effect it'll have on your pain level and just like your face overall.
Well, and so I will tell you, most of my patients come to me. My TMJ patients, these are the only patients that I don't have to call back and be like, hey, it's time. I do not have to hunt these people down. They will call me like, yep, I woke up with a headache. I need to see you. Where are you? When can I get in? Because it's really that intense. And so I have two questions when it comes to TMJ. First, how do I know I need to now send them to a dentist?
Oh, great question. So if their TMJ is controlled, once their TMJ...
Like if I inject them.
Yes.
And
they're not in pain anymore and they're good, I would always send them to a dentist, because usually, at least for a screening, because usually patients that have TMJ have some kind of what we call parafunction, like bad function. And so their teeth are probably not lined up. You have these cusps on your teeth. I like to use my knuckles because like I show how they line up. You have these like hills on your teeth, and they're meant to be fitting a certain way, like a jigsaw puzzle. And people that have TMJ, a lot of times those cusps or those hills are now worn down and damaged. So the teeth don't find a healthy balance. And even though you kind of mask the symptoms and the pain, the dysfunction is still there. And
is that how you decide who gets to do surgery?
Yes, that's how we decide. And who needs restoration. Sometimes you don't even need surgery. You can actually, once
what do you mean
your
restoration?
Oh, great question. Okay, so this is what I love to talk about. When someone comes into us and they're like cusps or the hills on their teeth are worn down because of TMJ, and now their TMJ is stable and they found a provider who can keep it stable and keep it under control, my job is 10 times easier because I can rebuild those hills on their teeth. And I can, yes.
I did not know that was an option.
We can totally rebuild them. That's called full mouth rehab.
Okay.
And it's so much fun. And it's funny because people come in because they're like, my front teeth are worn down. Because what they see is the effect that the jaw had on the front teeth. Now their jaw's fine. They're not in pain. Their front teeth are a little bit shorter. And like, why do my teeth look like this? What they don't realize is their back is like flat. If the front is short, the back's like totally worn down. And that's where we come in and we say, great, your drive is aesthetics, but what really needs to happen is we need to rebuild function into your teeth because you've lost the function. So once the jaw's stable, we actually rebuild those teeth and then we hold them in that proper alignment so that they don't have the effects of the wear anymore. The material we use is so important because we make sure we use material that's wear resistant. The way we design is so important. Measurements go into every step of the way. It's just so much fun.
Well, you have to have a perfect fit, right?
Yes. It's just so much fun. I can't even explain how fun it is because like we said, when you wear your teeth down, the distance between the tip of your nose and chin will decrease. So it's so much math. We have to like work backwards. Like, okay, this is the ideal distance. This is the
now
ideal
how do I get that?
How do I get that? Yeah. Sometimes aligners. Sometimes it might even be misalignment. We might be able to align their teeth into a better position to be a little less invasive. But many times we just do minimal prep dentistry to really restore those teeth back into like a really good place. It's so much fun. It's so much fun. But it's so much easier when like your jaw's under control. Because like if their jaw's out of whack, I'm like, oh my God, I can't do this. I think your jaw fixes. I can rebuild. But if the foundation is not under control, everything's gonna just like break, you know? Yeah.
And that's exactly, there's some of my patients that even after injecting them with so much Botox, they still cannot get that bite right?
Exactly.
As an aesthetic provider, let me tell you my biggest issue with TMJ, and this is where I hesitate or maybe even hold back with my patients where I don't fully correct them, but I give them a minor correction so they're just not clenching enough, is to me, and this has happened to a lot of my patients, you tox the muscle, the muscle atrophies, meaning it shrinks and it gets down and it gets slimmer, which you guys, there are people that come in to me because they want their face to be slimmer. And yes, people do treat the masseter muscle to be able to slim down their face. But you know what people don't realize is when you slim down back here, guess what's happening up front? You're getting that jowling right here next to the corners of your mouth. And so as we get older, our muscle mass is decreasing naturally anyways. The fat pads in our face are decreasing anyways. So now I have to play this juggling act on treating the TMJ, but still not getting jowling for my patients. And that jowling doesn't happen overnight. It's going to show up in a year or 2 years as that atrophy shrinks and shrinks and shrinks, right? Do you guys keep that in mind? What do you do for it?
That's such a good question. So actually what happens is whenever the patient comes in to get restorations, once they're controlled, we deprogram their jaw.
What do you mean deprogram their jaw?
So their jaw...
Is it a computer chip?
I know. It's so No, we actually have them wear like a splint for 2 weeks. Your jaw is such a fun thing. So your jaw has memory. It likes to go back. Yeah, it likes to go back to where it's trained to go. It's found a happy place. And even though, like I said, the Botox is going to help, or whatever treatment you do is going to help with the muscles, right? It's going to help relax them, but the jaw still has memory. So what we do is we give them a splint for like 2 weeks to deprogram it. Once we deprogram it, when we rebuild these teeth, it's not just to get them back into the right height, per se. It's actually to get them back into the right height in the correct, happy, natural jaw position. So what that should do in the long run is decrease their symptoms even when the treatment wears off.
Yeah.
Does that make sense?
So then I don't have to keep injecting them again and again because you've already reprogrammed the jaw to not be able to do that.
And they might need some level of maintenance, but it'll reduce the amount that they need.
So then I don't have to deflate their faces, and then we don't have to start worrying about jowling. And then that's a whole ball on it. On its own, right?
So when we rebuild these teeth, it's literally not just to rebuild them. It's so planned, and it takes like months sometimes to really figure out where is your jaw naturally happy. And that's where we rebuild your teeth into. Because your teeth, again, with the hills, they'll lock in and hold things into position. So night guards are involved, retainers are involved, like things are involved to keep things where they are. But that's 100% going to reduce the amount of jowling, the amount of like muscle atrophy and all that stuff.
I know. I like that.
It's so fun.
Well, I also like the fact that I don't have to keep injecting masseters.
Yeah.
And there's an answer for that.
There's an answer. Isn't it amazing?
You learn something new every day.
I know, but isn't that amazing? Because we have patients who they found like the mask, right?
Yes.
They know that they go and they go to their cosmetic provider and they know that they can get, the Botox and things are fine. But what they don't realize is the function is still affecting their teeth, wearing them down, and vice versa. Like y'all know that you can mask the symptoms, but what it's doing to the teeth and how their teeth
the root.
Exactly. And if they continue also grinding or clenching and losing their vertical, that's only going to increase the amount of
toxin I'm going to have to put in, and then eventually all these other things.
Yeah. So it's so related. It's almost like it's like illegal that we don't do this together all the time.
Yes.
Like, why is that allowed?
I don't know. Move it next to us.
I don't know why it's not allowed. It's like, this shouldn't be allowed.
Okay, let's talk gummy smiles.
Okay. Yes.
Now, I will tell you, for us, and for those of you who don't know, a gummy smile is when someone smiles and you see actually more of their gum line. You should only see the bottom very tiny bit. Just the stuff that comes between your teeth is the only gums that you should see. But a lot of people have a gummy smile, so that when they smile, you literally see the top of their teeth even. Now, I know in the aesthetics industry, we do talk about the distance between the end of the nose to the top lip versus the top lip to the chin. Like that has to be a certain proportion and a certain, level. We know that in the aesthetic industry, we give you a little bit of Botox in the corners of the nose. It relaxes that muscle so that I'm not changing the mouth. I'm changing the lips.
Yes.
And people don't understand that. By injecting that muscle and by freezing that muscle, your body physically cannot pull up your top lip, which is why you don't get to see the last half of the gums. What is my more permanent solution?
Great question. So gummy smiles can be for multiple things. Sometimes when it comes to dentistry, sometimes it could be just the bone growth. So if it's actually a skeletal problem, even them coming to you, you're not going to be able to relax.
Is that when the gum goes more forward?
Yes, like
versus
forward
down.
Forward and down. Yeah, forward, down. It looks like when they smile, their lip just goes way up above like this bony protrusion.
Got it.
That's just excessive maxilla overgrowth. And so what can we do? Surgery. Honestly, a lot of those people, if they had early ortho intervention as a child, that would have helped. A lot of times ortho can take care of that when they're younger. But If it's something that's bony, surgery would be needed. However, there's a lot of patients who have like a little bit of that gum still showing, or you're limited to how much you can control that lip. Like, you can only
There's only so much.
Exactly. And then after that, it's almost like, okay, well, I see a couple millimeters still. Like, what can I do about this? As dentists.
But okay, I don't want to interrupt you, but now you have that fight with the plastic surgeons. Because now it's very popular for people to go and get a lip lift. Or a retraction, like to go and get it surgically,
like elongated.
But
does that look good? I wonder if that looks good.
Well,
I feel like I haven't, like, I'll have to see a picture.
But how does that work with conjunction if you haven't fixed the bone?
Exactly. It would just look puffy. I feel like that's what I'm saying. Would that look good? I don't know if that would look good, because that might look almost like too much, like there's
I will be very honest, the people that have had these procedures done, and I have an eye for this, I'm trained to be able to look at the minute, minuscule things. I don't see that much of a difference when plastics does it.
Because there's also the same thing, right? There's a limit to how much will look good. That's what I mean. Like, as a male and a female, there should be, like there's like standards of the distance between the bottom of the nose and the top lip. So there's only so much you can add. So this is where dentistry, again, it's so good to get a consult with like a dental provider, because sometimes we're able to do gingivectomy, which is literally just peeling away the gum. So your gums
doesn't harm the teeth.
Exactly. So your gums have a certain distance that they need to be, that's required above the bone. So you have your bone level, you have your tooth in the bone, and then you have gum. Gums are like a blanket on top of your bone, I would say. And they're kind of creeping up on the neck of the tooth. So naturally, as dentists, we know that we cannot invade a certain distance. We have to make sure there's at least 2 millimeters of gum on top of the bone. Exactly. So let's say I probe a patient. I would just do a consult and I'd say, great, like Dr. Patel sent you here and she's done what she can, but you still have a little bit of lip show. Let's see if we have space for gingivectomy. So we literally, with a little mini ruler, go in and like measure the distance between their edge of their gum and their bone. If they're 4 millimeters, I can knock 2 millimeters off of that.
Yeah.
Which is great.
Yeah.
And that makes such a difference. I had a patient like this come in the other day. It's a friend.
Yeah.
And I've been telling her for so long.
You need to come in.
She came in, and it's so fun to do it too, because I always do half. And then like I stop and then
I call it the halftime show.
Yeah, like you need to see this, because it's so subtle that if you do the whole thing, it's almost like, what did you do? Yeah.
Yes.
But when you see the half, you're like, whoa. Yeah. I see it, and I'll
do the
pictures.
Same thing.
Yeah, right. Because it's like, oh yeah, I'm great. It's like so impressive, but it's like it's so easy. And we use lasers, so it's not like old school where we're using a scalpel to like cut and it's bloody. No, it is like immediately painless. 1-2 day recovery, just nothing. You don't need anything spicy or salty, and it's so good. They come back in a day or two, and their gums are healed entirely.
That's easy. That easy.
So easy. It just melts away. The laser just melts it away. So second thing, I know.
I love lasers.
Second thing we can do though, let's say that they need a little more. Let's say they didn't have that 4 millimeter space. We can actually go and remove a little bit of bone too, like safely.
Don't they do that for veneers? Anyways.
Exactly. So what then I would do is I'd cut the gum to where I want it to be. Assuming that the teeth are not going to look like horse teeth, right? The teeth have to look good, a certain distance, a certain length. We cut the gum to where we want it to be, and then we go up and remove bone within 2 millimeters of that edge that we created. It's just so fun.
Is that invasive?
No, it's actually not. You'd be surprised. So you can be invasive if it's like all around the tooth. When it's aesthetic, it's not invasive. If it's not aesthetic, if it's for a rest, like a big crown, then you peel the gum back and do it. That's pretty invasive. But nope, totally not. We don't even peel the gum. We don't even peel the gum back. We literally go in, little chisel, and stick it in. And it's amazing.
And be done.
I know, it's amazing.
I love that.
I know.
I did not realize that you could do something that minimal. Because when people don't get a corrected response with just toxin, my only was like, okay, well, go see your plastic surgeon.
Yeah. You can send them to your dentist.
Now I know I can send them to my dentist.
Yeah, go to your cosmetic dentist, see what they can do for you, see if gingivectomy, or that second procedure is called crown lengthening. See if gingivectomy or crown lengthening is an option. It's amazing. It's so amazing how dentistry's come a long way, though. Like, it really has.
Yes.
It wasn't.
But I don't think we realize that.
Yeah,
you guys are not that prominent on Instagram.
We're not that popular either. No one likes the dentist. No one wants to go to the dentist.
I need one of you to blow up on TikTok so the rest of us learn about it.
But you know what it is? We don't talk about this stuff. Like, I realize that dentists don't talk about how cool dentistry is. Like, it's so sad. We need to talk more about, like, we do cool stuff, guys, like every day, and no one knows it. It's kind of sad. Everyone just thinks we do root
Listen,
canals all
if
day.
either of my kids want to go into dentistry, I'm making them shadow you because you
I
just
love it.
so much.
I love it so. We do fun stuff. I do fun stuff.
Okay. Let's go back to the jawline.
Yes.
Okay. We know that with the aging process, the angle of the jaw comes forward. The chin recedes backwards. So literally your entire jawline is imploding in on itself. I know our solution, and we right now for that only have one solution, and that is either fillers or biostimulators. I reach more for my biostimulators because I think it gives me a nice crisp jawline. I'm actually stimulating collagen and not actually trying to fill them up. And you also don't need a lot of volume. You're just trying to retract a little bit of that skin back. Most people want a shelf. They don't want any skin laxity. We want a perfect chiseled jawline. How do you combat the aging, bony, structural changes in your industry?
Great question. Honestly, teeth. It's literally teeth. A lot
How
of
is
times,
teeth changing the angle of the jaw and the chin?
It's all vertical. So the way we are trained, the way we see it, this is a hinge.
Yes.
It's a hinge. So the more I lose my vertical on my teeth, the hinge is changing.
Got it.
It's all hinge. So if I open you up a little bit, I'm going to increase and elongate this and stretch things out a little bit, because naturally with time, almost everybody wear their teeth down and they don't realize it. And when you have a hinge joint.
Oh, we realize it. We just choose to ignore it.
Yeah, that's true too. Until it's like so obvious. And you're like, well, now we got to like reverse engineer everything. But when you have that hinge joint, the back molars, like the back teeth, that's what wears down first. That's why no one notices it. They don't notice it until that wear comes all the way to the front.
Got it.
But by then, it's like, you're looking at people that are probably in their late 50s, 60s, that see it more.
It's usually my mid to late 50s that you see that big change in the angle of the jaw.
Yep. And so what happens is that jaw angle, what we do the second we rebuild that vertical, we're opening up that jaw joint.
Yes. Because it pushes it back.
Exactly. It's like a counterclockwise movement. So we call it like clockwise growth versus counterclockwise. So we would just open them up counterclockwise. And it's, again, everything in our industry, everything aesthetic is related to the vertical. And the vertical is determined simply by your teeth, because your teeth are holding it. The one thing you can change in your mouth to change that vertical is your teeth.
That's it.
Because they're the stop.
There's nothing I can do for it.
Yeah. Like that's my stop.
Yeah.
Now, if you have shorter teeth than me, your stop is, shorter, and your vertical is different. Your jawline is going to be different. Your jawline is going to change in a different way or different fashion. And again, people just don't do anything about it until they start seeing the damage. And by then, the damage is like in the back is so much worse than the front.
We all know our patients go see their regular dentist and they get the teeth cleaning and all of it. And just like I know you know that not every aesthetic provider is the same. We know not all dentists are the same. Is there a certain age where you feel like, you know what, I would recommend all of my friends go at 42 and get a cosmetic dentist to come just as I'm big on prevention.
That's a great question.
To me, I feel like why are you getting a wrinkle before you address it? You know the wrinkles are coming, so let's get ahead of it.
Yeah.
What is coming for me in the dental space and realm that I need to be like, you know what, I need to go call Adeena and see if she can prevent this.
I would say 40.
40?
Yeah, I would say 40. Because we start seeing signs of wear and parafunction in their teeth early. Even the smallest wearing down on like the cusps, like those hills that I was telling you about, that'll start in the back, we see it immediately. And the best thing, like you said, prevention. Early on, what we can do, a lot of times if they still have those hills on their teeth, all they need is aligners. Yeah. I just gotta, again, figure out where's their jaw happy and how can I move these teeth into the happy place, because I have not lost my vertical yet. Got it. And I don't want to lose it. So when we see patients, we scan everybody that comes in. They get like an iTero scan, which pulls up their teeth in like 3D, and we show them their bite. We actually look at where's your bite the heaviest, because your masseters are strong. Like that's a force.
Oh my God, yes.
They're strong muscles.
By the way, to let you know, when you talk toxins in the face, your glabella is what takes kind of the most amount of units.
I didn't know that.
One masseter can handle as much as your glabella.
Wow.
So when I do masseters, like if we're talking Daxify Botox units, standard is about 20 units here. Yeah, I have patients that I have done 20 units of Botox on
Masters are strong.
Each masseter.
And with grinders, like you'll see they have like this big, nice square.
Because as a practitioner, I can test the strength, but I don't know how deep that muscle goes.
Yeah, exactly.
You never know when you're injecting it. And so sometimes you can freeze the superficial part of it, but they still have that little bit underneath that's clenching.
Exactly. Oh, yeah. That makes total sense.
Yeah.
But speaking of the masseter, like same thing, whenever when we see patients that are clenching, grinding, their masters are huge. Like they're just like training their masters, like going to the gym. I'm like, your masters are, you're working them out. You know, they're like big muscles. And then when we scan the patients and we see basically where is their force the heaviest on their teeth, it's always the same. If the force is heavy there, it's like a heat map. You kind of see this, like when you watch the Weather Channel, it's like red. And that's how it shows up on our scan. And it shows us like, okay, this is where you're biting heavy. This is where you're not biting so heavy. We need to balance this out. And when I remove the colors, you'll see the same places that are biting heavy are flat.
Oh, nice.
They're flattened.
Yeah.
So early on, when they're younger, all we need to do is move those teeth into a better balanced position for the jaw. Yeah. So the jaw's not so unhappy. It's like when you go to the chiropractor and you get aligned. Like alignment. We just got to align your teeth a little bit. And getting straight teeth is a cherry on top. Some people have like pretty straight teeth, so they're like, I don't need aligners. I'm like, this is not.
That's not about straight teeth.
Yeah, this is not about straight teeth. This is about your bite and your function and how your current bite is damaging your teeth and the effects long term that you'll see over the years if you don't do something about it.
Got it.
Yeah.
Is there a stopping point, or do you wish, and I'm asking this on behalf of all of my aesthetic providers, is there something that you wish we would all either do or not do? You're like, you guys have got to stop doing this, or you guys have got to pay attention to this when we do it.
I think just look in the mouth. I know it's weird. No one wants to look in the mouth. It's gross. I totally get it. No one wants to do that. That's what dentists are for. But I really feel like it's just a matter of looking in the mouth and seeing if the teeth are okay, because I wish or just send them to a dentist to get like a consult to see, hey, you know, we've seen that this can affect your teeth, and I'd like you to just go get a consult and just see if your teeth are okay based on your parafunction, like your jaw's dysfunction. Let's just get it checked because your teeth are in your jaw. I wish that they would send patients to us, because I really do think it would decrease the amount of units that you have to use. Yes. And help the patient get the smile that they need.
Yes, because I don't want to use that many units. Exactly. I would rather use, like I said, the least amount possible. Yeah. Because over time, that deflation in volume is going to cause jowling. Yeah. And that's my main concern, is the jowling, right?
Yeah. So anyone who you think will get jowling, I would just say send them to dentist, because there's so many factors that we can do. There's so many things we can do to help balance their bite and their teeth to make it so that they don't need as much treatment, and then, you know, things will last longer. And the sooner you send them, the less invasive we have to be as well. Like the less costly it is for them, the less time consuming it is for them, the less invasive it is. It's just like a win-win-win situation. And most people don't really even go to the dentist. Like if they have nice teeth, they think like, I'm fine. I don't need it. My teeth aren't hurting. I'm totally fine. I don't need to go to the dentist. But they don't realize what a role their jaw is playing on their teeth. They really just come in, like you said, for pain.
And how it's changing as they're getting older.
Yeah. Oh, yeah. Definitely changing as they're getting older.
Okay, so 40 is when I feel like all right, guys, if you're 40, go get your mammogram and go see your cosmetic dentist.
Keep it easy. Yep, exactly.
We're going to add one more to the checklist.
Exactly. Love it. That's what they need to do. Just as important as getting
mammogram and your cosmetic dentist.
You need to get your teeth checked. You do.
Let's talk about the aging process with the jawline and the mouth. I know we talked about kind of the big problems that majority of the population are concerned with, but again, prevention. And I want to know, as I'm getting older, the only thing I've ever heard of to make your smile and make you look good is veneers. Like, yes, if you really care about the way you look, as you get older,
you need to get veneers.
You need to get veneers.
Everybody needs veneers.
Everybody needs veneers.
Like, you're gonna need
Hollywood has veneers.
Yep.
Is that true?
No, it's not. I mean, there's a time and place for veneers, and you know, we're really conservative. Like, we are conservative cosmetic dentists. It's sad.
I tried to get veneers, and my cousin was like, no.
Yeah, because the thing is, like, as dentists too, like, I feel like I've turned people away from veneers. Like, I've told them, I don't think that's what you need. Like, I really like it's so fun talking to patients to figure out what is bothering you about your teeth. Like, what exactly is it? The color, the shape, the size, like what aspect, because there's so many things we could do to be non-invasive.
Yeah.
Veneers do play a role. If again, you have to
because I don't want dentures ever.
Oh,
like
yeah.
if please tell me how I can never ever get dentures in my life.
Okay.
I literally, you want me once a month, I will be there once a month, but I don't want dentures.
I have patients who are like in their 60s, 70s, 80s, 90s that have all of their teeth, including their wisdom teeth.
I have my wisdom teeth, by the way.
Yeah, great. Love it. Me too. But it's like, you can. It's totally doable. It's literally just clean your teeth. Most people lose teeth because of one of two reasons. And I'm going to tell you, early on, it's cavities. Early on, it's always like sugar intake and just not controlling it, not taking care of your teeth. Later, it's perio. Perio is when you're just not cleaning them well enough and not going to your dentist well enough, and that their hygiene is great, meaning they're brushing good, like on top what they see. But
we're brushing and flossing, but we're not realizing
underneath the gum what's happening.
Do the gums get looser the way the tissue gets looser? Like, they don't.
They shouldn't. They only get looser if they have buildup along the gum line.
Okay.
But oh my gosh.
So that tissue doesn't act like the rest of the tissue in the body,
aging,
right?
No.
And I know it's squamous.
Yeah.
But we have squamous cells in other parts of our bodies. Mm-hmm. And those get looser.
Yeah. No, it does not have to get looser. As long as you maintain your hygiene, your gums are meant to be like super tight. Loosening gums in the mouth has everything to do with hygiene.
Got it.
It is like the simplest solution. You just got to get cleaning.
And it's not just about flossing?
Oh, it's about flossing and brushing. Both. It's like if you like sweep.
But you just said if you can have good hygiene, but you still won't know.
Because you don't know what's under the gum. So if you have good hygiene, but your gums are bleeding or you feel like they're a little bit red, there's something going on under the gum. So you need to go to
Is that something that I need to be doing at home then?
No, that's why you need to go to the dentist.
Got it.
So once you go to the dentist and you get everything taken care of and you're like in a maintenance phase, depending on how much damage has been done, you can maintain a lot better at home. And that's why we love what we do, because I'm doing my job if you have to come to me less.
Yes.
If you're coming to me and you're continuing to come to me and you're inflamed every time, I will sit you down and say, hey, what's going on? Like, either I suck at my job or you're not doing what you need to at home. Like, there's no way that you need to come this often. So when it comes to gums, what happens is it's kind of like grout lines. I love to use this analogy. It's like when you at home and you're trying to clean, the grout line's going to get dirty no matter how much you clean. You have to regrout
that thing.
Exactly. So the junction between your gums and your teeth is like a grout line.
Yeah.
Stuff's going to pack there. It's going to pack there. And then it's going to go down into it. And then when it goes down into it, your gums are going to start bleeding a little bit. Gingivitis. A lot of people have gingivitis. Totally okay. Manageable yourself if you keep brushing. Unlike the rest of our body, we're told if something's hurting or bleeding, stop, right? In the gums, if it's bleeding, that means you probably need to brush more. Like, you're not brushing enough. That's a trouble spot. But if you leave it as it is, it continues to progress, or you just stop brushing there because you're afraid it's bleeding, it will actually encroach into the bone, and then bone loss starts to happen.
And then that's when your jawline really changes.
And that's when you get the loose gums.
Yes.
Because your gums are shifting away because the bone's going down.
Yeah.
And remember, there's a 2 millimeter tightness that it needs. So if the bone's going down, it's going to the 2 millimeters is going to go down, and the rest of the gum is going to loosen.
Yeah.
And as it loosens, more is going to pack.
Got it.
And then the bone doesn't come back. And so people lose their teeth because they literally lose their bone. I have had patients come in with teeth like
stubs,
like moving, like floating. Their gums are high, but they're like, why are my teeth loose? I'm like, because your bone is gone.
Got it.
It's crazy.
Got it.
Yeah. But that's two reasons: cavities, early age; later, perio. Just not going to the dentist enough and not taking care of your gums, and they don't hurt. They're bleeding, but they don't hurt. So you're like, I'm fine. My teeth are fine.
But because we do. That's kind of how we're taught, right? Yeah. Like, if it doesn't hurt, then it's not broken.
Yeah.
Then it's not broken, and then you don't need to fix it.
Yep.
But you're gonna come to me because you're like, I hate the way my smile is, and all of those.
Yep.
Okay, one last question before we go. So before we go home, and this has nothing to do with the jawline whatsoever. Okay. It's just because I'm curious. We want the perfect smile. Mm-hmm. We want the perfect lips. We want the no smile lines. We want no folds. We want it.
Want it all.
We want it all. And in that all, we want perfectly white teeth.
Yes.
Is there such a thing as too much teeth whitening?
No.
Okay.
say no.
This is a personal question. Like, am I using my strips too much?
Well, like, go with what your body feels, but there's a balance, I would say. So when you whiten your teeth, you're essentially,
because you hear that those chemicals are really bad for you, and they wear down the enamel in your teeth.
They don't. They actually don't. Teeth whitening is safe because what it's doing is it's opening up your pores and then infiltrating. So the chemicals are infiltrating into your teeth, but your enamel is solid.
They don't damage your teeth?
No, but isn't good is like abrasive products. Like a lot of whitening products over the counter can be abrasive, like baking soda, charcoal based. Yes, they'll whiten your teeth, but what they're doing is that's what's wearing down your enamel. When you're using a gel or you're using like carbon monoxide from your dentist,
and not just the strips.
When you go to the dentist, they're never going to use something abrasive.
No, I have always gotten the gel.
Exactly, because it's soft. It's not damaging your enamel. What it's doing, though, you do get zingers. If anybody's gotten whitening, you know what zingers are? Like it's like a shooting random. Like, whoa, what is that? That's a zinger. It's because your enamel has pores in it. If you imagine. So whitening, it will open up your pores so the bleach can get picked up. So then now your pores take a little bit of time to close back up. And in that process, we say don't have any red wine, don't have any coffee, because your pores are open. So the bleach got picked up.
I chose the white wine today.
Oh, smart.
I was like, I have a dentist in the chair. I need to make sure I do white wine.
I literally was in the car before coming in here and I texted Dr. Mac, my partner. I was like, I need to whiten my teeth. I don't like how they look right now. I'm on this podcast. I need to whiten our teeth. I don't need Invisalign. I need all these things, but it's getting there. We're going to get there. But we don't use anything really abrasive. That's what would damage your teeth is if you're using
abrasive
stuff. No.
Okay.
Mm-hmm. Strips are good. Gel's good. Anything that is like very just, rough. Some toothpaste, like whitening toothpaste, I'd be really careful. I really do like the Sensodyne whitening toothpaste.
Okay.
Because they're softer. Because those people already have sensitivity.
Yeah.
Of course, anything over the counter will take longer to have effect and a maximum effect. When you go to the dentist, you don't need too much whitening. That's the beauty of it. When you go to the dentist and get professional whitening, you can get like custom trays made. Like we make all of our patients custom trays with our whitening and give them gel to take home.
Yeah, that's what I've had.
Yeah. And then after that, you just need to touch up with the gel. Yeah. And as long as you're touching up, you're totally fine.
Okay.
Yeah. And your body, the only thing I would say is just don't
listen to your body.
Yeah, listen to your body. Don't whiten and you're like dying and it's hurting and you're just like,
I can't have water anymore.
Maybe don't do that. But it's fine. Yeah, you can whiten.
Okay. Well, I think that's all of my questions. Thank you so
You're welcome.
much for sitting down with me. I had a lot of fun and I learned so much.
Oh, good.
I feel like now I need to come see you and get my preventive visit done.
You do. We all do. You all do. I do. I need to go.
Well, cheers and thank you for hanging out with us.
Oh, thank you for having me. It was a blast.
Disclaimer. The information provided in this podcast is for educational purposes only and is not intended as medical advice. Please consult with your qualified healthcare professional to determine the best treatment options for your individual needs. Results may vary and all procedures carry some level of risk. Always make informed decisions in consultation with a licensed professional.